sudden cardiac arrest strikes without warning. What would you do?
Sudden cardiac arrest occurs when the heart suddenly stops beating, cutting off blood supply to the body. It is commonly referred to as cardiac arrest. But is cardiac arrest really something that has nothing to do with us? Did you know that the number of daily deaths from cardiac arrest is nearly 12 times higher than that of traffic accidents?
In 2023, while approximately 2,500 people died in traffic accidents in Korea, nearly 30,000 died from heart disease and sudden cardiac arrest. That breaks down to about 7 traffic deaths a day, but a staggering 80 deaths related to cardiac arrest.
The only way to save someone experiencing cardiac arrest is a cardiopulmonary resuscitation, commonly known as CPR. If a bystander immediately performs CPR, the chances of a survivor can increase by 2 to 3 times. The miracle of saving lives with just 2 hands, that is CPR. But how much do you actually know about CPR? Starting now, we'll teach you everything you need to know about CPR. The number of cardiac arrest cases is steadily increasing worldwide, and Korea is no exception. Cardiac arrest is closer than you think. In fact, 30.6% of cardiac arrest occurs during daily life, 47% of which are at home, and 35.8% are witnessed by families. So it's important for everyone to be prepared for emergencies.
According to the WHO, in 2023, cardiovascular diseases, including sudden cardiac arrest, are the leading cause of death worldwide, with sudden cardiac arrest alone accounting for around 20% of all deaths. According to Statistics Korea, heart disease accounted for 9.4% of all deaths in South Korea in 2023. And about half of those were estimated to be due to sudden cardiac arrest. As a result, the number of cardiac arrest deaths has been steadily increasing over the past 5 years.
Even at this moment, someone is at the crossroads of life and death due to cardiac arrest. So what happens to the body when cardiac arrest occurs? How does the life clock in our body flow in just a few minutes? From now on, let's take a look at the shocking changes that occur in our body every moment of a cardiac arrest.
The heart plays a vital role in sustaining life. More than just a pump, it ensures the delivery of oxygen and nutrients throughout the body. When the heart stops, blood flow ceases, and the body's life-sustaining systems begin to collapse rapidly. During cardiac arrest, the oxygen supply to the body's cells is interrupted, causing them to shut down and become damaged. Among all cells, brain cells are the first to be damaged. They stop functioning almost immediately after cardiac arrest and begin to die within about 4 minutes. After about 10 minutes, irreversible brain damage occurs, making resuscitation nearly impossible and often leading to brain death or death.
The first 4 to 5 minutes after cardiac arrest are considered a critical, golden time. CPR is known to increase a cardiac arrest patient's chances of survival by 2 to 3 times. When CPR is combined with the use of an automated external defibrillator AED, survival rates can increase by 3 to 5 times. However, without CPR, the chance of survival decreases by approximately 7 to 10% for every minute that passes, which is why performing CPR immediately is crucial.
To resuscitate a cardiac arrest victim, a 5-step emergency response sequence must be followed without interruption. Understanding and applying the 5 links in a chain of survival can make a crucial difference in saving lives. If even one of these steps is missed, the chances of survival decrease significantly.
The first link in the chain of survival is recognizing cardiac arrest and calling emergency services 119 in Korea. The second link in the chain of survival is immediate CPR. The bystander should begin chest compressions without delay and continue until emergency responders arrive. The third link in the chain of survival is the rapid use of an AED. The device delivers a shock to help restore a normal heart rhythm. After the shock, resume CPR immediately.
The first 3 steps require immediate action from bystanders. The first step is recognizing cardiac arrest and calling for help. Next, high-quality CPR must be performed to maintain blood circulation. Finally, an electric shock should be delivered using an AED to restore the heart's normal rhythm.
The fourth link in the chain of survival is rapid advanced emergency care. When paramedics arrive, they administer advanced CPR and transport the patient to the hospital as quickly as possible. The fifth link in the chain of survival is specialized hospital care and recovery. In the hospital, targeted treatments support survival and long-term rehabilitation.
If the first step recognizing cardiac arrest and calling 119 is delayed even by a single minute, the effectiveness of the subsequent steps, including CPR, AED use, and advanced medical care, can decrease dramatically. If CPR is started within 1 minute of cardiac arrest, the survival rate can be as high as 90%. However, with every passing minute, that chance steadily decreases. The first few minutes of emergency care are critical and can mean the difference between life and death. So if you witness someone experiencing cardiac arrest, call 119 right away and begin CPR without hesitation.
Does CPR still seem unfamiliar or difficult? On the contrary, it is simple and anyone can learn it. CPR is not difficult and we can all learn easily. Now, let's go step by step through the 4-minute miracle that can mean the difference between life and death.
CPR is the first critical step to saving a life. In an emergency, stay calm and follow these steps in order. First, check for responsiveness. If the person has collapsed, gently tap their shoulders and call out loudly to check for a response. If others are nearby, point to one person specifically and give a firm instruction, like this.
The man in the blue hat, call 119. Who wears a leather jacket? I need an AED.
Next, observe the patient's chest and abdomen for 5 to 10 seconds to check for breathing. You can also feel for breath by placing the back of your hand near their nose and mouth. Make sure to complete this check within 10 seconds.
If you find a person in cardiac arrest and there is no one else around, what should you do? It's natural to feel overwhelmed, but in that moment, remember, you are the victim's only lifeline.
When you find someone collapsed, call Emergency Services 119 immediately. Put the call on speaker so your hands are free. Clearly describe the patient's condition and your exact location, and request emergency assistance.
A person has fallen. There is no breathing, so it appears to be cardiac arrest. Your current location is Daehan-dong Mingguk Apartment, Building 3, Room 1003. Please come quickly.
Please keep the phone on your side and follow the instructions.
Quick tip. The first step in CPR is critical as it initiates the chain of survival. Before moving on to the next step, let's review it carefully. Now, what if the victim is found lying in a different position?
Hello? Hello? Can you hear me?
Before turning the person over, always check for responsiveness first. Now, let's learn about the core step of CPR, chest compressions. If the victim's heart has stopped, your hands must take over its function and help restore circulation. Since the heart is no longer able to pump blood on its own, you must manually maintain blood flow through compressions.
First, lay the person flat on a firm surface. Remove any clothing to expose the chest and identify the correct compression point. Place the heel of your hand on the lower half of the sternum, roughly 3 to 4 centimeters above the xiphoid process, the tip of the breastbone. Interlock your fingers and lift them off the chest, making sure only the heel of your hand touches the compression point. Use your body weight to press down, keeping your elbows straight. Your shoulders should be directly over your hands, forming a straight, stable line like an isosceles triangle to apply effective force. Push hard and fast, about 5 centimeters deep and no more than 6 centimeters, at a rate of 100 to 120 compressions per minute. Let the chest fully recoil after each compression. Continue until emergency responders arrive.
The correct compression rate is 100 to 120 compressions per minute, about 2 compressions per second. It is important to maintain this rhythm consistently and perform compressions quickly. Maintaining a steady and consistent rhythm is crucial. Compressions that are too slow or uneven will not circulate blood effectively. Let's check once more if we are keeping the correct pace.
Perform 30 compressions per set and switch with another rescuer after 7 sets if possible. What happens inside the body when CPR is done correctly? Each compression forces blood out of the heart and circulates it throughout the body. Your hands are essentially acting as the heart, keeping blood flowing to vital organs.
Now let's move on to the third step of CPR, rescue breathing. According to the 2020 Korean CPR guidelines, chest compressions should be the top priority, but rescue breath should be added depending on the situation. For most adult victims, chest compressions alone are enough to improve survival rates. However, in case of a drowning, infants or young children where breathing failure is the primary issue, rescue breaths are essential. Let's now learn the proper techniques for rescue breaths so we can respond flexibly to different emergencies.
After chest compressions, give rescue breaths. Gently tilt the head back and lift the chin to open the airway. If the airway is blocked, air cannot reach the lungs. Pinch the nose shut, cover the mouth completely with yours, and give 2 breaths within 10 seconds. Each breath should last about 1 second, just enough to make the chest rise visibly. Blow for 1 second and check if the chest rises. Blow again and observe the chest. It's important not to overventilate. Too much air can be dangerous. Give only the amount of air needed to make the chest rise slightly. What happens inside the body when you give rescue breaths? The air you blow in travels through the mouth and airway, reaching deep into the lungs, specifically to the alveoli, the tiny air sacs at the ends of the bronchial tubes. These alveoli are surrounded by a network of tiny blood vessels capillaries, where gas exchange takes place. Oxygen passes through the alveolar walls into the bloodstream, while carbon dioxide moves from the blood into the alveoli to be exhaled. This process supplies oxygen to vital organs and removes waste gases from the body. Now, let's combine chest compressions and rescue breaths. One cycle includes 30 chest compressions, followed by 2 rescue breaths. Repeat this cycle 5 times. If you're alone, continue CPR without interruption until emergency personnel arrive.
According to 2023 statistics from the Korea Disease Control and Prevention Agency, more than 30,000 out-of-hospital cardiac arrests occur annually in Korea. Over 2/3 of these cases happen at home or in public places. Whether a bystander is able to perform CPR at the moment of cardiac arrest can make a decisive difference in the patient's chances of survival. In CPR, chest compressions and rescue breaths take over the function of the stopped heart, and lungs circulating blood and supplying oxygen to help bring the person back to life.
When cardiac arrest occurs, the heart suddenly stops or beats irregularly, preventing blood from circulating throughout the body. In addition to CPR, there's another powerful life-saving tool, the automated external defibrillator, in other words, an AED.
An automated external defibrillator is a critical device that analyzes the heart's rhythm and, if necessary, delivers an electric shock to restore a normal heartbeat. According to data, approximately 40% of out-of-hospital cardiac arrests are caused by arrhythmias such as ventricular fibrillation or ventricular tachycardia. In these cases, an AED is the only effective way to correct the rhythm. CPR alone cannot resolve arrhythmias, which is why using an AED is essential for increasing survival chances.
An AED may seem intimidating if you are not familiar with it. However, AEDs provide step-by-step voice instructions, making them easy for anyone to use in an emergency. However, while AEDs are easy to use, it is crucial to follow the correct procedure to ensure their effectiveness. And now let's go through the 7 steps of using an AED following the 2020 Korean CPR guidelines.
Step 1. Gently tap the person's shoulders and shout to check for
Hello?
a response.
Hello?
If there's
Are
no
you okay?
response,
Can you
move to
hear
the
me?
next step immediately. Step 2. Call emergency services 119 and ask a bystander to bring an AED if available.
The man in the blue hat, call 119, who wears a leather jacket. I need an AED.
Step 3. Check for normal breathing. If there is no breathing or only gasping, continue to Step 4. Step 4. Start chest compressions immediately. Push hard and fast on the lower half of the sternum at a depth of 5-6 cm at a rate of 100-120 compressions per minute.
Then, please immediately compress the chest.
I brought an automated external defibrillator.
Do not stop compressions until the AED is ready to use. When the AED arrives, one rescuer should continue chest compressions while another turns on the device and follows the voice instructions. Take out the pads and place them as shown, one just below the right collarbone and the other below the left armpit. Continue compressions while placing the pads.
Connect the pad. Connector to the AED.
Stop compressions and make sure no one is touching the patient during rhythm analysis.
Stay clear of the patient. Analyzing heart rhythm.
Analyzing. Stay clear.
If a shock is advised, the AED will begin charging.
Shock is advised. Charging.
Please start chest compressions.
Stand clear of the patient.
Perform cardiac shock according to voice guidance.
Everyone, step back. Do not touch the patient.
Press the flashing shock button.
Continue compressions while it charges. When prompted, press the shock button.
I'm going to press it. Please step back. 1, 2, 3.
Defibrillation was performed. Start CPR immediately.
Immediately resume CPR after the shock is delivered. The AED will automatically reassess the rhythm every 2 minutes. Continue CPR as instructed until professional help arrives. Even if no shock is advised, continue chest compressions without interruption. This sequence is critical to improving the patient's chance of survival.
According to the International Liaison Committee on Resuscitation, the use of an AED can increase the survival rate of cardiac arrest patients by 3 to 5 times. Today, AEDs are becoming more widely available in places such as schools, airports, gyms, shopping malls, and tourist attractions. Raising public awareness and encouraging the active use of AEDs is another crucial key to improving survival rates from cardiac arrest.
So far, we have covered the full CPR process for adults. However, cardiac arrest can happen to anyone regardless of age. Infants and young children are smaller and more fragile than adults, requiring a different approach to CPR. How does CPR differ for infants and young children?
Child CPR differs from adult CPR in a few key ways. Due to their smaller size and more delicate structure, compression depth and technique must be adjusted. Use the same location, the lower half of the sternum, but with only one hand. Place the heel of your hand in the center of the chest and use your other hand to gently hold the forehead steady. Compress the chest to a depth of 4-5 cm at a rate of 100-120 compressions per minute. If the child is not breathing, call Emergency Services 119. Then begin CPR, 30 chest compressions followed by 2 rescue breaths. Cover both the child's nose and mouth. Give gentle breaths just enough to make the chest rise. Avoid overinflating, as children need less air than adults. Because cardiac arrest in children is often caused by breathing problems, rescue breaths are especially important.
According to research, approximately 500 children experience out-of-hospital cardiac arrest each year. A common mistake parents make in this situation is rushing to the hospital while holding their child. However, the real danger lies in the loss of oxygen during transport, which can make the situation even more critical. Therefore, if your child is in cardiac arrest, it is much more important to report it to paramedics and start CPR on the spot immediately than to take them to the hospital. So, how is the CPR for infants different?
First, check if the infant is in cardiac arrest.
Baby, are you okay?
If the baby is unresponsive, gently tap the soles of their feet. If there is no response, check for breathing by observing chest and abdominal movements and listening for breath sounds for 5 to 10 seconds. If the infant is not breathing or only gasping, assume cardiac arrest, call emergency services, and begin CPR immediately.
The baby isn't breathing, and it's an infant under 12 months old. Daehan Apartment, Unit 1003, Hangakdong. Please hurry.
Infants between 28 days and 1 year of age are very small and fragile, so CPR must be performed with extra care. For chest compressions, use 2 fingers, the index and middle fingers, placed just below the nipple line. Use the fingertips to gently press the chest. Use your other hand to stabilize the infant's head by placing it on the forehead to prevent movement. Compress the chest about 4 cm deep, or approximately 1/3 the depth of the chest, at a rate of 100 to 120 compressions per minute. Ensure the chest fully recoils between compressions. After 30 chest compressions, give rescue breaths. Cover both the infant's mouth and nose with your mouth, and gently exhale a small puff of air, just enough to see the chest rise over 1 second. Infants have small lungs, so avoid overinflation, which can lead to hyperventilation. If the infant does not resume breathing, continue cycles of 30 compressions and 2 rescue breaths until emergency responders arrive.
Now we have covered the entire process of CPR, including the use of an AED. Are you feeling a little more confident about administering CPR now? But emergencies are not limited to cardiac arrest. Choking caused by food or small object blocking the airway is also a common and potentially life-threatening situation. Since just a few minutes can determine the outcome, let's learn how to respond to choking emergencies.
Airway obstruction is a life-threatening emergency where an object blocks the throat or windpipe, preventing breathing. If the person can cough, wheeze, or speak, it's a mild obstruction, and they may clear it on their own. Encourage them by saying, "Keep coughing." However, if they can't cough, speak, or make sounds, and show signs like clutching the throat or turning blue, it's a complete blockage.
Do you need help?
Start first aid immediately. Lean the person slightly forward and support their chest with one hand. Deliver 5 firm back blows between the shoulder blades using the heel of your hand. If the object is not expelled, begin abdominal thrusts, Heimlich maneuver. Stand behind the person with 1 foot between theirs for support. Place your fist above the navel and below the breastbone, grasp it with your other hand, and give 5 quick upward thrusts. Repeat 5 back blows and 5 abdominal thrusts until the object is cleared or the person can breathe or speak. For pregnant women or obese individuals, use chest thrusts instead of abdominal thrusts. Place both hands on the center of the chest between the nipples and give 5 quick thrusts.
Choking is often more dangerous for infants than for adults. Their weaker digestion can cause them to vomit and obstruct their airway, and they often swallow objects without distinguishing them properly. If an infant under 1-year-old experiences airway obstruction, what should we do?
If a child is not breathing and appears limp, this is considered a complete airway obstruction, and emergency intervention must begin immediately. First, lay the infant face down along your forearm, ensuring the head is positioned lower than the chest. Support the infant's head and neck with one hand and use the heel of your other hand to deliver 5 firm back blows between the shoulder blades. Next, turn the infant over and lay them face up on your thigh or lap, keeping the head lower than the body. Using 2 fingers, perform 5 chest thrusts just below the nipple line. Continue alternating 5 back blows and 5 chest thrusts until the object is expelled and normal breathing resumes.
Now we have covered both CPR and emergency care for choking. But no matter how well you know these techniques, they will not make a difference unless you put them into action. If you ever hesitate or feel anxious about providing help in an emergency, don't worry too much. Under Article 5 of the Emergency Medical Act, you will not be held legally responsible for performing CPR or airway obstruction first aid with good intentions. Even if the outcome is not favorable, do not hesitate. Your actions are protected. The most important thing is to take the first step with courage. Remember, just few minutes of emergency response can double or even triple a victim's chances of survival. Practice, build confidence, and become the first link in the life-saving chain. I hope you gain confidence by practicing emergency measures such as CPR and become the first link to save your life.
CPR is more than just an emergency skill. In Korea alone, more than 30,000 cases of sudden cardiac arrest occur every year, with over 2/3 happening at home or in public places. In those critical moments, whether someone nearby knows how to perform CPR can make a clear difference in survival. When you learn and practice CPR, you're not just preparing to save a life, you're protecting your family, your neighbors, and even strangers. The more people who know CPR, the safer our society becomes. Restarting one person's heart is not just saving that person, it's saving a family, a community, a life filled with connections. That's the real reason we all should learn CPR.
Even in those critical first 4 minutes, life can be saved. A single act can change a life and a family's future. Your hands can create miracles. You can change the world.